Laura, will you please share with us your prior dental experience that has caused you to seek out Dr. Meyer?
Sure. Wow, okay. Trying to think about how to do this. Wrap it up. I wanted to lose weight. I got up to be about 214 pounds. And I went and saw a doctor out in Santa Monica. We lived on Maui in Hawaii, and I couldn't find a really good naturalistic doctor or just somebody to do like a whole, find out what's going on with my body, and my hormones were all messed up, but there was also something going on that just made me feel tired all the time. So I went and saw this doctor, and he ran a bunch of tests, and he really believes that if there's infection in the body, you are not going to lose weight. So and balancing hormones too. We needed to do that. I had a hysterectomy when I was 46 years old, and so my hormones were really messed up, and I gained all this weight. Anyhow, how does that relate to my teeth? So my C-reactive protein is a test that tests for inflammation, heart problems, things like that. My heart was fine, had all that checked out. So the C-reactive protein being high meant that I had an inflammatory process that was happening in my body, either allergic or infection. So did the whole elimination diet, cleaned up my diet, got on really good protein powder, and did the food sensitivity test, and started eating really well and taking care of myself and going on walks, and still that C-reactive protein wouldn't go down. So that meant that, okay, I've taken care of my allergic process. Now what's causing this inflammation? And he said there's two things that can be hidden in a person's body that could cause a high C-reactive protein lab test. One of them is the two places of infection are teeth and ingrown toenails. So my feet are fine. Luckily, I didn't have that problem. He knew I had root canals, and so he said, well, you know what, I'm going to send you to my dentist to send people to, and let's just have that all looked at. So I went to my dentist and had my teeth re-x-rayed. I'd had my teeth checked just about 6 months before that. Had those x-rays sent in from Hawaii. And the dentist was like, you have an infection. And the infection looks like it's all the way into maybe your jawbone from these root canals up here that I had. And these were 20 plus years old root canals. So what happened then was he sent me to his endodontist, who, and I'm smiling, but inside I'm crying because this was really bad. He told me that I should have a re-root canal. The teeth should be cleaned out and re-rooted, and there was one down here too. That was $5,000, if not more, of money spent there that sent me down the rabbit hole of poorer health. One of the things that, if I could convey to anybody who watches this video, is that if you have a compromised root canal, you need to have that tooth pulled. Which leads me to, how did I get here? So we moved from Maui to Arizona so I could go to naturopath school. I had run a little wellness center out in Maui, and it really invigorated me that I wanted to become a doctor. What kind of doctor? I wanted to become a holistic doctor who looks at the whole body and why are we getting sick and what's behind the sickness. And for me, it really was looking at my teeth. I went to another, I'm not going to say who, here in the Phoenix area, because it really, there's no blame in this. This is my journey. And I went to another company to have my teeth pulled, the infection cleaned out. I had bone grafts put in on this area of my mouth. We were just going to work on this side because I still needed to chew. We knew I had problems. I had root canal teeth down here too, but we were just concentrating on these 3 teeth up here, 3 molars. So they had to heal from the bone graft, and then later they put in the root canal, the implants, and those implants failed. And that's what brought me here to see Dr. Meyer, because there wasn't a holistic approach at their practice of, what's going on here. I didn't know that they failed until I saw Dr. Meyer. And I think one of the best things that Dr. Meyer does here is he has the wealth of knowledge to look deeper, and he also is willing to figure things out differently, I think, than any other dentist that does implants. Because, to try and wrap it up, my bite was also compromised, and the way that my implants were put in, it gave me sleep apnea. So we needed to widen my bite back out and make room for my tongue so that I would sleep better and not swallow my tongue. So besides getting rid of the $17,000 worth of implants and the infection that still hadn't healed, he gave me back my sleep, he gave me back my health, and worked outside the box and figured how to engineer my teeth so that they would fit properly in my mouth. And then he built up all my other teeth to match, and there's a lot more to it, but I would say that's like Dr. Meyer's really good quality that he has, talent that he has, for sure.
Great. Great. So long journey led you here to Dr. Meyer's office. Yeah. And just kind of in closing, tell me how you feel this treatment has impacted your life. I know that you said sleep, physical, there's a lot of ways, but in a nutshell, share with the people that are watching how this has truly impacted your life. Because I think that's the root.
Oh, absolutely. When we started out in 2012, and it's 2016, and I'm finished. Because once we finished with this side, we had to get the diseased teeth out here. And first of all, this was a huge letting go process. I loved my teeth. I didn't want to let my teeth go. I think that there are a lot of people out there that know what I mean by that, because they spend a lot of money having root canals done. The question you ask yourself is, are you willing to go through what I just went through in almost $50,000 to save your health because you decided to have a root canal? I think that all dentists should really look deep inside and know that they're really doing their patients wrong by sending them to an endodontist. My goal in speaking my truth is to put the endodontist industry out of business. Sorry, but I've had my health back. Root canals could have killed me, could have led to I was on a downward spiral. Mm-hmm. I'm up again, I'm feeling well, I've lost 14 pounds, I'm on my way to feeling energized, the brain fog's gone. I've done a lot of other things too. Like, I've got the infection out of my mouth, but I've also gotten my hormones balanced, but I've gotten the energy to do all that because of the dental work, getting the sickness, the illness out of my mouth. And our mouth is where we eat, it's where we talk, it's where we love, it's where we express. So we want our smile to be nice, we want our teeth to look nice, and we don't want to lose them. But sometimes we just have to let it go. And that's what I had to go through. It was very emotional for me. I cried. I was like, I don't want to lose my teeth. It was, think about how close they are to our brains. They rule our organs. They have energetics to all our organs. So there's this normal, natural attachment to our teeth that I think when your health is compromised, you have to really go beyond that and say, okay, pull this tooth out. It's making me sick. Mm-hmm. And that's the piece that I want all dentists to really embrace and really add that to the practice, this conversation of letting go, that it's time to let go of this disease tooth that's dead. You don't want a dead thing in your body because it will continue to make you sick. It did for me.
Mm-hmm. Great.
Yeah.
Thank you, Laura, for sharing with all of us.